Today, we're discussing a significant public health development, the first ever human case of H5N5 avian flu, which has been confirmed in Washington state. This marks a notable and concerning event for health officials. This incident marks a global first for the H5N5 strain, as it's the initial documented instance of a human being infected with this specific type of avian influenza anywhere in the world. It's a critical development. This is also the first human avian flu case identified in the United States since February, drawing significant national attention to the situation. This time gap highlights the rarity of such occurrences. The patient, an older individual from Grays Harbor County, is currently severely ill and remains hospitalized. Medical teams are providing intensive care as they monitor the patient's critical condition. Symptoms reported include a high fever and confusion, both indicating a serious medical condition. These signs suggest a significant impact on the patient's health, requiring immediate attention. The patient is also experiencing difficulty breathing, a critical symptom that requires intensive medical care. This respiratory distress is a key indicator of the severity of their illness. Officials noted that the patient had underlying health conditions, which may have contributed to the severity of the illness. These pre-existing factors often complicate recovery from viral infections. The most likely source of infection is believed to be the patient's mixed backyard flock of domestic poultry. This suggests a direct link between the patient's environment and the virus. This flock consisted of various types of domestic birds, common in many rural settings. The diversity of the birds could have influenced the transmission dynamics within the group. These domestic birds had exposure to wild birds, which are known to carry and spread avian influenza viruses. This interaction is a common pathway for viral transmission to domestic flocks. Wild birds often act as natural reservoirs for these viruses, migrating and potentially transmitting them to other populations. Their extensive travel makes containment challenging for health authorities. A public health investigation is currently ongoing to determine the full scope of the situation and prevent further cases. This proactive approach is vital for understanding and mitigating risks. Washington state has recently seen dozens of avian flu detections in wild birds across various regions. This widespread presence of the virus in wildlife indicates a heightened environmental risk. These detections also include waterfowl, which are particularly susceptible to carrying and spreading the virus. Their mobility contributes significantly to the geographical spread of avian influenza. Backyard poultry flocks have also been affected, underscoring the risk to domestic birds. This highlights the importance of biosecurity measures for all poultry owners, regardless of scale. This local activity mirrors a national increase in avian flu detections, indicating a broader trend across the country. This widespread viral circulation affects both wild and domestic bird populations. Despite widespread detections in birds, no other human cases of H5N5 have been identified in Washington state. This remains the sole confirmed human case of this specific subtype to date. Importantly, human-to-human transmission of avian flu has not been documented. This lack of sustained spread between people is a key factor in public health assessments, reducing pandemic risk. Previous human cases of avian flu in the United States have involved the H5N1 strain, a different but related virus. Both belong to the broader H5 group of avian influenza viruses. The H5N1 strain has affected thousands of cattle across the nation, posing significant challenges to the agricultural industry. This widespread infection impacts livestock and food safety concerns. Commercial poultry operations have also faced outbreaks of H5N1, leading to economic losses and stringent control measures. These outbreaks necessitate culling and strict biosecurity protocols. Additionally, while birds have been widely impacted by H5N1 over the past 2 years, contributing significantly to its spread, their role as mobile carriers makes containment challenging. Most H5N1 human cases have been mild, often presenting with flu-like symptoms that resolve without severe complications. This pattern is generally reassuring for public health officials. However, one fatality linked to H5N1 was reported in Louisiana in January, reminding us of the virus's potential severity. This tragic event underscores the need for continued vigilance. This new H5N5 case underscores the critical importance of ongoing surveillance efforts for avian influenza. Continuous monitoring is essential to detect new viral threats and their impact. It also highlights the continuous need for public health vigilance to detect and respond to emerging threats. Preparedness is key to mitigating spread and protecting communities effectively. Stay informed and follow guidance from health authorities, such as the CDC and local health departments. These organizations provide essential, evidence-based recommendations for public safety. By staying aware and taking recommended precautions, we can collectively work to protect ourselves and our communities. This collaborative effort is essential against emerging infectious diseases,